Just started Ozempic and wondering when you will feel it working? You are definitely not alone. One of the most common questions I hear is, when will I start seeing results? So let us walk through exactly what to expect and when. I am a licensed pharmacist, and this is Pharmacist Online. I simplify complicated health topics and make them easy to understand. In our last video, we talked about the full Ozempic dosing schedule, from your very first dose all the way up to the maximum of 2 milligrams. Now, let us talk about how long it actually takes to start seeing results. So, here is the short answer. Ozempic starts working in your body right away, but noticeable changes usually take a few weeks, sometimes even a few months. Let us break that down, step by step. Weeks 1 through 4. You are on the starter dose, that is 0.25 milligrams once a week. This dose is not meant to control blood sugar just yet. Its main job is to help your body adjust and lower the risk of side effects, especially nausea. So if you are not seeing much change at this stage, do not worry. That is completely normal. Week 5 and beyond, this is when treatment really begins. Most people step up to 0.5 milligrams around this time. This is the first dose that actively starts lowering blood sugar. You may begin to notice fewer spikes after meals, more stable readings, and for some, the early signs of weight loss. Weeks 8 to 12. This is where Ozempic starts to show its full effect. Clinical studies show that most people begin to see real improvements in their hemoglobin A1C between weeks 8 and 12. If you are tracking your blood sugar at home, this is when you will likely notice more consistent numbers and a steady downward trend. And what about weight loss? That usually takes a little longer. Some people notice changes within the first month, but for others, it may take 2 or 3 months, especially if they are also working on healthy eating or lifestyle habits. By 6 months, most people who respond well to Ozempic see the full benefit, both in blood sugar control and weight loss. Now, here is the key. Consistency is everything. Ozempic only works if you take it once a week, every week. Try to take it on the same day each week and avoid missing doses. And if you have been on Ozempic for 12 weeks or more and have not seen much improvement, that is a good time to talk with your doctor. You may need a dose adjustment, possibly moving from 0.5 to 1 milligram or even 2 milligrams, depending on how your body is responding. Let us do a quick recap. Weeks 1 to 4. Your body is adjusting week 5 and beyond. Active treatment starts at 0.5 milligrams. Weeks 8 to 12. Most people see real A1C improvement month 2 to 3. Weight loss often begins by month 6. You will likely see the full benefits if your body responds well. Now, I would love to hear from you. Have you started Ozempic recently? How long did it take for you to notice a change? Drop your story in the comments. Your experience might help someone else who is just getting started. In our next video, we are going to answer another big question. Can you stay on Ozempic long term? We will cover the benefits, risks, and what to expect. If this video helped, tap that like button and leave a comment with your questions or thoughts. And do not forget to subscribe to Pharmacist Online for more clear, real-world health advice you can actually use. Take care, and I will see you in the next one.